Okay, let's talk about the assessment of the heart. We assess by stethoscope, electrocardiogram, Doppler, echocardiogram. One thing that's not mentioned here is that we can also get some assessment on size and disease by x-ray. And there is now a new SNAP test that can tell us if cats are producing a certain chemical that subjects them to HCM, hypertrophic cardiomyopathy. So, with the stethoscope, we know what the stethoscope looks like. And then we listen. So, we auscultate is the listening, AU, our med term for ears. We auscultate on the left side to hear most of the things that we want. Because when we think of hearing the lub-dub, if our stethoscope is placed here, where the arrow is, we will see or hear the pulmonic valve, as we can see depicted is right about there, and the mitral valve, the two largest sounds for making lub-dub sound. If we want to detect an abnormality like a murmur, that is, a murmur is a defaulty valve in some sort form of another, we would have to move the stethoscope around. So here's our pulmonary valve, here's our mitral valve, which has the most common heart murmurs. Over on the right side would be the tricuspid valve, and then the aortic valve, back on the left side. There are two other issues, the arterial duct and the ventral septal defect. So arterial duct has to do with PDA, patent arterial ductosis. That is where patent means flowing. So if we were to check a catheter that is patent is a catheter that is flowing. So I'm going to go back to this, and our blood goes out the pulmonary artery, and in neonates that are not born yet, it has a duct transferring from the pulmonary right into the aorta, because it does not need to go out to the lungs and return, because they are not breathing oxygen. They are getting their oxygen from the mother. So when the infant is born, or puppies and kittens are born, this starts to close. If this does not close, then they are not circulating and oxygenating correctly, because some of their deoxygenated blood is traveling back out through the aorta and not circulating like how it should. So this is a constant whooshing sound that you would hear, whereas when you hear a murmur from a valve, it's more like a lub-whoosh, lub-whoosh. And this would be, you'd still be hearing the lub-dub sound because the valves are working properly, but you would hear a constant whoosh, sh, sh, as it pumps through. So the ventricular septal defect means that the wall between the two ventriculars has some sort of defect, and that is allowing blood to pass back and forth. So as they contract, it is mixing the blood, and that means some unoxygenated blood is probably traveling back through the body somehow, and some blood is just recirculating around. So the electrocardiogram, ECG, EKG is because in Germany, K is how they spell cardio. This measures the pulse. So remember, the SA node is where the pulse starts and arrives at the AV node, goes down the bundle of His and up the Purkinje fibers, which causes the contraction. So this is what we use to detect arrhythmias. So a VPC is a common arrhythmia. That is our ventricle premature contraction. So we hear, this is the P, QRS, and then T wave. So this is where the atria contracts, the ventricles, then it refills. So here we had the atria contract, the ventricles, then it refilled, but we missed the atria contracting and the ventricles jumped ahead, and that makes this wide and bizarre. This is also what we treat with lidocaine, which is a local anesthetic, but it will also treat. So to figure out some math here, these are a 32 kilogram, we would give 6.4 mils, and a 12 kilogram, 2.4. So Doppler and oscillometric are what we are using to measure the blood pressure. So that is the amount of blood on the exerting on the walls. So we read that as systolic because systolic is from the squeeze from when the ventricles contract. The oscillometric pressure reading, you just put on the cuff, press a button on a machine, and it reads. And oftentimes in surgery, I check both of them, and they are very close. So remember, systolic is squeeze, diastolic is the dilation, where the ventricles relax, but there is still pressure in the vessels. So the echocardiogram is the gold standard for detecting any sort of myopathy changes. So we will also be able to see clearly if valves are having function. So here is a valve moving. Here is also a valve moving. This might be a valve without a function or proper functioning because it looks like you see a lot of fluid still passing through there and not a solid closure. Over here, same thing. It looks like this one's closing all the way, opening and closing, but this is partially closing. So animals that have hypertrophic cardiomyopathy, you will be able to detect this. You will be able to see a thickening. If this is meant to be the ventricle wall, the doctors can judge how thick that wall is, if that's getting thick, or the other way with dilated cardiomyopathy, which we see valve disease in most small breed dogs, and we see DCM, dilated cardiomyopathy, in most large breed dogs, so like Great Danes and Doberman Pinschers. So it is always good to recommend that owners schedule with a cardiologist just as a checkup, maybe at 4 or 5 years. Speak to the veterinarian on when the recommendation is preventative is better than trying to find a cure for heart disease, especially if they have a large breed dog. The other thing that would warrant an echocardiogram is if they're eating grain-free diets, because there is now starting to become a link with DCM and grain-free, mostly because we have found that breeds that were not prone to having dilated cardiomyopathy were showing up at veterinarians, and this was the common factor. There are still a lot of studies to be done about this. But as I was saying, there are a lot of studies to still be done, and DCM is not something that is just brand new. It's always been around, but when it starts happening in breeds that don't usually get it, the veterinarians are trying to do studies on why that is. All right, so congestive heart failure. Most of the time, it is going to be from mitral valve disease, which can also be the bacteria that is in our mouth in pets that have really bad periodontitis and need dentals. That bacteria seems to be attracted to the mitral valve. So keeping dogs' health with preventative dentals is a good thing. Heartworm, and then hypertrophic cardiomyopathy, the HCM usually leads to fate because the muscle wall is built up so much that backs up the atrium, and then as that blood starts to pool and be stagnant, it starts to clot, and then it passes through the aorta, but where it needs to divide at the saddle thrombus is where it does the clot. Then we have dilated cardiomyopathy. So our congestive heart failure is often seen right-sided. We will see backup of ascites. So this is a clinical sign of ascites where fluid is building up in the abdomen, whereas left-sided, if we think about how blood flows, left-sided will back up into the lungs. The major drugs that are associated with treating chronic renal failure. We have beta blockers that end in LOL, like propranolol. They decrease heart rate and force of contraction, which lowers blood pressure and makes the heart beat more slowly with less force. So when we think of cardiac output, is the stroke volume plus the heart rate. We always want this to be equal. The body likes homeostasis. So if the volume being pumped out is less than what it should be, the heart rate is going to elevate itself to make this equal. This also goes hand in hand with different sized dogs. We have small dogs like Chihuahuas with smaller volume. They have higher heart rates, whereas our bigger dogs have more volume and lower heart rates because the cardiac output to sustain all the tissues needs to be equalized. The body wants homeostasis, no matter what size you are. So back to the drugs. We have calcium channel blockers that end in pine, like amlodipine. This interrupts the movement of calcium into the cells of the heart and some blood vessels. This may decrease the heart's pumping strength and relax the blood vessels. ACE inhibitors end in pril. They're the benazepril. They expand blood vessels and decrease resistance. This allows blood to flow more easily and makes hearts work easier and more efficient. Pimobendan is the gold standard drug I'll talk about here in a minute, but we also have aspirin, which is the blood thinner, not recommended unless by a veterinarian because this will reduce clots. This prevents the platelets from sticking together. So if a cat has HCM and is at risk for getting a saddle thrombus or fate, then yes, aspirin would be warranted, but by the doctor. We also have diuretics, which diuresing is urinating, and these are furosemide and spironolactone, which causes the body to rid itself of excess fluids and sodium through urination. This helps reduce the heart's workload because it decreases the fluid buildup in the lungs. We have vasodilators like acepromazine, but pimobendan also works as an inodilator, so it does cause some vasodilation, which helps reduce, this is in the vessels, so it helps reduce the preload and increases the contractility, the force and speed that the muscle contracts. These are dosages for other drugs to use, and since chronic heart failure in dogs is due to valvular deficiency, we will often see the fluid backing up into the lungs, but we might see changes in body weight, intolerance to exercise, and the heart working healthy with the kidneys are always happy. Usually if we have to decrease the amount of blood for the heart to be happy, the kidneys start getting upset and they start trying to tell the bones to produce more blood. And it's a constant battle going back and forth. So heartworms, scientific name, Dirofilaria immitis, transferred by the mosquito. These like to live in the pulmonary artery. If they die, it would just be dead worms. Right now they're swimming and alive and they're able to stay with the flow of blood. They're worms that like to flow with the blood, but if they all died, they would go and block the pulmonary artery. This would mean blood would not be able to get to the lungs. The dog would have sudden death. So if this is treated and there are a lot of dead worms, it takes the body time, all those macrophages and the white blood cells that are going to eat them, it takes time for them to disintegrate everything. So it is highly recommended that you have dogs rest for the appropriate time and get a echocardiogram because you'd be able to see the worms in it. We can test for this with our SNAP test, and we can prevent it really easy. Prevention is always better than trying to cure something. The adulticide is what kills them. It's not recommended in cats because cats usually have a lower worm burden. Their immune system helps to get rid of that, and if we do treat them, they could have risk of anaphylaxis. They're toxic to the treatment. They could get pulmonary edema. And here is why we want to restrict the activity because we do not want dead worms to cause that. So think about these questions. And we'll talk about blood vessels. So our arteries, arterioles, carry oxygenated blood. It transfers in the capillaries, then goes to the venules, and then the veins. So oxygenated blood goes through arteriole, still depicted as red here, makes the transfer in the capillaries, which the capillaries only allow one cell at a time. This is where diffusion is at its greatest, where things will move from its higher concentration to its lower concentration, and oxygen transfer, nutrients, and everything can take place. Then it goes to the veins through the venules. These are some of our major arteries. And this is what a saddle thrombus would look like. Artery is a lot bigger, transfers down. This is where the femoral artery divides off. So the arterioles going forward, and then the capillaries. We can see here on a microscopic histopathic image that there is just one blood vessel squeezing through at a time. One thing about the veins is that they have valves in them. Valves are made of connective tissue and they prevent backflow of blood. If we sleep at night, our blood gets back to our body, to our heart, through muscle contraction. Our muscles are always contracting. Sometimes valves start to get weak and faulty and then allow the backflow of blood to happen. Then the veins get overstretched because they do not have a lot of strong muscle around them, smooth muscle as our arteries do, and then we get these things called varicose veins. We have to prevent horses for what we call stocking up because we need to wrap their legs to prevent swelling. They do not have a lot of muscle on their distal limb to be able to contract this, and if they're standing for a long amount of time, they are not doing lots of contraction as they are moving around often. Our common veins that we draw blood from. Depiction